Hello, are you preparing for the examination of BSc Nursing? Do you need any guidance for pharmacology, pathology and genetics? Then you have come for the right place. Let's see about the pharmacology, pathology and genetics. First, let's discuss about the syllabus. First, Unit 1, Introduction to Pharmacology. So here you have the definition and branches of the pharmacology. So here you will study what is pharmacology and the branches of pharmacology, and mainly nature and sources of drugs, dosage forms and routes of drug administration, then terminology used, classification, abbreviations, prescription, drug calculation, weights and measures, everything you will study regarding the drugs. Then you will study regarding pharmacodynamics, actions, drug antagonism, synergism, tolerance, receptors, therapeutic, adverse toxic effects, pharmacovigilance, pharmacokinetics, absorption, bioavailability, distribution, metabolism, interaction, excretion, review, principles of drug administration and treatment. These all things you will study in this unit. Then factors affecting dose, route, etc. Then Indian pharmacopoeia, legal issues, drug laws, scheduled drugs, rational use of drugs, principles of therapeutics. These things you will study in Unit 1. Unit 2, Pharmacology of commonly used antiseptics and disinfectants. So antiseptics and disinfectants are also very important. Every time they will ask the classification of antiseptics and classification of disinfectants, and sometimes they will ask the difference between antiseptics and disinfectants. So here you need to see the composition, action, dosage, route, indications, contraindications, drug interactions, side effects, adverse effects, toxicity and role of nurse. So in each classification you need to write one drug and you need to explain all these things for every and each drug. Next, Unit 3, Drugs acting on GI system. So here pharmacology of commonly used drugs, emetics, antiemetics, laxatives, purgatives, antacids and antipeptic ulcer drugs. So here important drugs are antacids. Okay. Then next, antidiarrheals, fluid and electrolyte therapy, that is furazolidone, dicyclomine. Then here also you need to write the composition, action, dosage, route, indications, contraindications, drug interactions, side effects, adverse effects, toxicity and role of nurse. Next, Unit 4. So here drugs acting on respiratory system. The pharmacology of commonly used anti-asthmatics, bronchodilators. Bronchodilators are very important. Sometimes they will ask for 2 marks and sometimes they will ask anti-asthmatics and bronchodilators for 5 marks. You need to write all the anti-asthmatics and any one drug you can explain. Then next, decongestants, expectorants, antitussives and mucolytics. Next, bronchoconstrictors and antihistamines. Antihistamines are also very important questions. They will ask for 2 marks. So whatever drugs you write, you need to write the composition, action, dosage, route, indications, contraindications, drug interactions, side effects, adverse effects, toxicity and role of nurse. This you must include in all the drugs. Next, Unit 5. Drugs used in treatment of cardiovascular system and blood disorders. So here you will see the hematinics and treatment of anemia and anti-adrenergics. Treatment of anemia is very important. Sometimes they will combine and they will ask the question in 10 marks. Sometimes they will ask for 5 marks. Then adrenergic drugs for congestive heart failure and vasodilators. Vasodilators are also very important. Then anti-anginal. Sometimes they will ask the question like this. For example, write the treatment for angina. Sometimes they will ask anti-anginals. Then next, antiarrhythmics, antihypertensives, coagulants and anticoagulants, antiplatelets and thrombolytics, hypolipidemics, plasma expanders and treatment of shock, and drugs used to treat blood disorders. So here mainly they will ask antihypertensives. So I told you in this unit important things are antihypertensives, then anti-anginals. Next, Unit 6. drugs used in treatment of endocrine system disorders. So here insulin and oral hypoglycemics. Insulin is very important, so they will ask for 2 marks or sometimes for 5 marks. They may ask for treatment of diabetes insipidus or diabetes mellitus. Like that question also you may get, or sometimes they may ask directly write about insulin. Then thyroid and anti-thyroid drugs, steroids, corticosteroids, anabolic steroids, calcitonin, parathormone, vitamin D3, calcium metabolism, then calcium salts. Next, unit 7, drugs used in treatment of integumentary system. So here antihistaminics and antipruritics. So here antihistaminics are very important. So it may come for 2 marks or it may come for 5 marks. Then topical application for skin, that is benzyl benzoate, gamma BHC, clotrimazole, miconazole, silver sulfadiazine for burns. These and all drugs are very important drugs. So sometimes they may ask just clotrimazole. You need to explain about the mechanism of action, dosage, route, indications, contraindications, drug interactions, side effects, adverse effects, toxicity and role of nurse of clotrimazole. So sometimes they may ask the direct question like antifungals. You need to write the example clotrimazole and you can. Next, unit 8, drugs used in treatment of communicable diseases, common infections and infestations. So here you will see the general principles for use of antimicrobials. Antimicrobials is an important question, it will come for 5 marks. Then pharmacology of commonly used drugs, that is penicillin, cephalosporins, aminoglycosides, macrolide and broad spectrum antibiotics. Broad spectrum antibiotics is also an important question and it will come for 5 marks. Sometimes they will ask aminoglycosides and also macrolide. Then cephalosporins, anaerobic infections, anti-tubercular drugs, anti-leprosy drugs, then anti-malarials, this is also important. Antiretroviral drugs, only sometimes they will ask for 2 marks. Then antiviral agent, antihelminthics, anti-scabies agents, antifungal agents, these all are for 2 marks questions. So here you need to write composition, action, dosage, route, indications, contraindications, drug interactions, side effects, adverse effects, toxicity and role of nurse. These all things you need to include with the drugs. Finished pharmacology 1. Next let's see pharmacology 2. So here we are going to study pharmacology 2 in 4th sem. But the examination, it will come togetherly, pharmacology 1 and pharmacology 2. So first unit, drugs used in disorders of ear, nose, throat and eye. So here also again we are going to study regarding antihistamines. In pharmacology 1 also we studied antihistamines under the integumentary system. Here again we are going to study. So here topical application for eye, that is chloramphenicol, gentamicin eye drops, ear, then in the ear again ear drops, then nose and buccal cavity, chlorhexidine mouthwash, then all regarding the composition, action, dosage, route, indications, contraindications, drug interactions, side effects, adverse effects, toxicity and role of nurse. These all things we will study in this. Here the important question is for the eye. Eye it is important. Next unit 2, drugs used on urinary system. Pharmacology of commonly used drugs, that is under that renin-angiotensin system. So in the renin-angiotensin system you need to draw the RAS system diagram, then under that you need to explain what is RAS system. Then diuretics and antidiuretics, these are also very important questions. Every year they will ask this. Then drugs toxic to kidney. So here drugs toxic to kidney, there is no explanation. Some of the drugs they have given in the textbooks. You need to write the name of the drugs. They will ask this only for 2 marks. Next, urinary antiseptics. Under urinary antiseptics, you need to study treatment of UTI, that is acidifiers and alkalinizers. These and all you need to study. So they will ask treatment of UTI for 5 marks. Next, unit number 3, drugs acting on nervous system. Basis and applied pharmacology of commonly used drugs, analgesics and anesthetics. Here analgesics question is very important. They will ask for 5 marks. Sometimes they will ask analgesics, sometimes they will ask for classification of analgesics. Here you need to explain what are analgesics, then all the classification of analgesics and one example of drug under the classification. Then anesthetics. Anesthetic also it is a 5 mark question. Sometimes directly they will ask anesthetics, then sometimes they will ask classification of anesthetics. So here you need to explain about all the drugs. Sometimes they may ask for 2 marks also. For example, general anesthesia or local anesthesia, like this. Then next, non-steroidal anti-inflammatory drugs. This is also a very important question. This unit is very important because you may get 3 to 4 questions in this single unit. Antipyretics is a 2 marks question, then opioids and other central analgesics. Under that again general anesthesia, then pre-anesthetic medication, what you will give before the anesthesia, everything we will see in this. And some of the anesthetic comes under the gases, that is oxygen, nitrous oxide, carbon dioxide and others. Then hypnotics and sedatives also, it is a 5 mark question. So here you need to explain regarding the hypnotics and sedatives and what is the difference between hypnotics and sedatives. You need to explain all these things. Next, skeletal muscle relaxants, then antipsychotics, mood stabilizers, antidepressants, anti-anxiety drugs, anticonvulsants, and drugs for neurodegenerative disorders and miscellaneous drugs. So these all drugs, it comes in psychiatry, so it is related to nervous system, that's why we are studying here. And under all these drugs, one drug will come for the examination. They may ask anti-anxiety, or sometimes they may ask antipsychotics, or sometimes they may ask mood stabilizers. Next, stimulants, ethyl alcohol and treatment of methyl alcohol poisoning. Methyl alcohol poisoning is a very important question. They may ask for 2 marks. So you need to explain what is methyl alcohol poisoning and what antidote you are going to give for that poisoning. Next, unit 4, drugs used for hormonal disorders and supplementation, contraception and medical termination of pregnancy. So here mainly we will see regarding the drugs which we give for hormonal disorders, for example estrogens and progesterones, then oral contraceptives and hormone replacement therapy. Oral contraceptives also, it is a 5 marks question. Every year they are asking this question repetitively. Then vaginal contraceptives, drugs for infertility and medical termination of pregnancy. MTP or medical termination of pregnancy, this is also a 5 marks question. Then uterine stimulants and relaxants. So this is also a important question. Here either they will ask stimulants or either they will ask relaxants. Next, unit 5, drugs used for pregnant women during antenatal, labor and postnatal period. So here during the antenatal period, what and all we are using. For example, we are going to give tetanus prophylaxis. Then during the pregnancy, we will give iron, vitamin K1 supplementation. So these all things we will study. Then during the labor, to induce the labor, what and all drugs we are using? Oxytocin, misoprostol, ergometrin, then methyl prostaglandin F2 alpha, magnesium sulfate, calcium gluconate. These all drugs we are going to study under this. So here the important drugs is oxytocin. Oxytocin is very important. Then misoprostol also, it is very important. Sometimes they may ask for 5 marks and sometimes they may ask for 2 marks. Next, unit 6, miscellaneous drugs. So here we will discuss about the drugs which we have not discussed in other units. For example, drugs used for de-addiction, drugs used in CPR and emergency drugs. Emergency drugs are very important. As you know, adrenaline they will ask every year, and dexamethasone, hydrocortisone, chlorpheniramine, these all are important drugs, and mechanism of action, it is very important. Every time they will ask for 2 marks. Write the mechanism of action of dexamethasone, write the mechanism of action of hydrocortisone, like that they will ask the questions. Then IV fluids and electrolyte replacement. This is also a very important question. So here Again, you have some common poisons, drugs used for treatment of poisoning. For example, it may be a snake bite or something else, the poisoning. So these all things you need to study. So anti-snake venom for snake bite, this is also very important. They may ask for multiple choice questions. Then vitamins and minerals, supplementation, vaccine and sera, immunization program, then anti-cancer drugs, chemotherapeutic drugs commonly used, immunosuppressants, immunostimulants, all these things we will see in the Unit 6. Unit 6 is a very big chapter, so you need to study most of the things because several questions they will give by this unit. Next, Unit 7, Introduction to Drugs Used in Alternative System of Medicine. Alternative system means other than allopathy. So, for example, Ayurveda, Homeopathy, Unani and Siddha, all these things we will discuss. Here we are not going to discuss very detailedly, just superficially we are going to see. So, they may give the question like this, alternative systems of medicine for 5 marks. You need to explain everything little. Then next Unit 8, that is fundamental principles of prescribing. So here what and all principles we will follow during the prescription of drug. So what kind of patient we have got, whether he is old age, whether he is adult, whether he is a kid, we will see that and we will prescribe the drug. So here what is the role of nurse? Then legal and ethical issues related to prescribing, then principles of prescribing, steps of prescribing, prescribing competencies, this and all important. So mainly here you need to study the steps of prescribing and principles of prescribing. This is important. So hereby we have finished the discussion about pharmacology 1 and 2. Next let's see pathology. So first pathology 1, it comes in third sem. So first unit 1, introduction unit. So here in this unit we will see the importance of the study of pathology, then the definition of terms in pathology, then cell injury, etiology, pathogenesis of reversible and irreversible cell injury, then necrosis, gangrene, these all things we will discuss under this. Then cellular adaptations, that is atrophy, hypertrophy, then hyperplasia, metaplasia, dysplasia, apoptosis, all these things we will discuss in this unit. So here there is a chance to get more MCQs and there is a chance to get more 2 marks question. Next, inflammation. Under that, acute inflammation, vascular and cellular events, systemic effects of acute inflammation, then chronic inflammation. So these are also 2 marks questions. Sometimes they may ask the difference between acute inflammation and chronic inflammation. Sometimes they may just ask acute inflammation or chronic inflammation for 2 marks. Next, wound healing. Wound healing is 5 marks question. Every year they will ask this. This is very important question. So here you need to write what is wound healing and what are the steps of wound healing, everything, and you need to explain that. Next, neoplasia. Nomenclature, normal and cancer cell, benign and malignant tumors, carcinoma in situ, tumor metastasis, general mechanism, routes of spread and example of each route. So how it will spread the cancerous cell, whether it is benign or metastasis. These all things we will discuss under this unit. Then circulatory disturbances, that is thrombosis, embolism, shock. So here this is also all 2 marks question and shock they may ask for 5 marks. Next, disturbances of body fluids and electrolytes, that is edema, transudates and exudates. So in this unit more we may get MCQs type of questions. Next, unit 2, that is special pathology. So here pathological changes in disease conditions of selected systems. So here we are going to discuss about the systems. So first one is respiratory system. So under this, pulmonary infections, that is pneumonia, lung abscess, pulmonary tuberculosis. So here what and all things are happening in the body during this disorder, we will see that. So especially the pathology. Then chronic obstructive pulmonary disease, chronic bronchitis, emphysema, bronchial asthma, bronchiectasis. So here COPD is very important. Then tumors of lungs, cardiovascular system, atherosclerosis, ischemia and infarction. Then rheumatic heart disease. So rheumatic heart disease is a 5-mark question here. Then infective endocarditis, gastrointestinal tract, under that peptic ulcer disease, then gastric and duodenal ulcer, then gastritis, H. pylori infection. So here gastritis is important. Next, in oral mucosa, oral leukoplakia, then squamous cell carcinoma, then esophageal cancer, then gastric cancer, then intestinal, typhoid, ulcer, inflammatory bowel disease. Under this, so here inflammatory bowel disease is very important, and typhoid also it is important. Then colorectal cancer, liver, gallbladder and pancreas. Under that, under the liver, hepatitis, amoebic liver abscess, cirrhosis of liver. So here hepatitis and cirrhosis of liver is a important question. Either they will ask hepatitis or they will ask cirrhosis of liver. Then next, gallbladder. Here cholecystitis, then in pancreas we will see the pancreatitis, then tumors of liver, gallbladder and pancreas. So under this we have pancreatitis, that is important question. So in this unit all the systems are included, so the questions will be more from this unit. Next, skeletal system. Under this, bone healing, osteoporosis, osteomyelitis, then tumors of bones, then under the joints we have arthritis, then rheumatoid arthritis and osteoarthritis. So here arthritis and osteoarthritis is very important. Then next we will go to endocrine system. So here diabetes mellitus is a very important question. Every year they are asking this diabetes mellitus. Either it may come for 5 marks or it may come for 2 marks, or sometimes related to that they may ask MCQ also. The next, goiter, carcinoma, thyroid. These questions will come under this unit. Next, let's discuss regarding unit 3. That is hematological test for the diagnosis of blood disorders. So here blood test, what and all test we are doing to find out the disorders. For example, we will check the hemoglobin, then white cells, then platelet count, PCV, ESR. These and all individually they may ask for 2 marks, or sometimes direct question they may give like write the all the blood test like this for 5 marks. Next, coagulation test, that is bleeding time, prothrombin time, then activated partial prothrombin time, blood chemistry, blood bank, all these things they may ask. Then under this, sometime under the blood grouping they may ask many MCQs. For example, which blood will match for this person, like this they may give some cross questions. Then next, blood components, plasma pheresis, then transfusion reactions, all these things comes under this unit. So here in the blood transfusion is very important. So hereby we have completed pathology 1. Next, let's move towards pathology 2. So here it comes in 4th sem. So first unit 1, special pathology. So here pathological changes in disease condition, again it is getting continued from 3rd sem to 4th sem. So there we saw some systems. So here we are going to see other systems. So first, kidney and urinary tract. Under this, glomerulonephritis. Glomerulonephritis is very important topic. They will ask for 5 marks. Then pyelonephritis, renal calculi, cystitis, renal cell carcinoma, renal failure. So under this, renal failure is also very important topic. Next, male genital system. Under this we have cryptorchidism, testicular atrophy, prostatic hyperplasia, then carcinoma of penis and prostate. So in these 4 disorders, cryptorchidism is very important. They will ask for either for 5 marks or for 2 marks. Next, female genital system. Under this, carcinoma of cervix and carcinoma of endometrium. These both are also important. Then uterine fibroids we have, then vesicular mole and choriocarcinoma, then ovarian cyst and tumors. Then under breast we have fibrocystic changes, then fibroadenoma, then carcinoma of the breast. So here carcinoma of the breast is a very important question. They will ask for 5 marks. So you need to write what is carcinoma of the breast, then the stages of the carcinoma. Next, central nervous system. Under this we have meningitis, encephalitis, then stroke and tumors of CNS. In this, encephalitis is very important. Either encephalitis or meningitis they will ask. Then next, let's move towards the unit 2, that is clinical pathology. Under clinical pathology, what and all we will see? We will see all the types of examinations of the body cavity fluids. So here, how you will do the examination, how you will collect the body fluids, everything you will see under this. So here, examination of CSF is very important. Then you will see the sputum collection, then wound discharge collection, then specimen for various clinical pathology, then biochemistry and microbiology test, then analysis of semen. Under this we will see the sperm count, motility and morphology and their importance in infertility. Next, urine test. Under urine test we will see the physical characteristics of the urine, then we will do the analysis, then we will do culture and sensitivity. So when we will do this, when the patient has UTI or related any infections, that time we will go for the urine test. Next, feces. Under this we will see the characteristics, stool examination, occult blood, ova, parasite and cyst, reducing substances, etc. Then how to collect it, the methods of the collection, then collection of the urine and feces for various tests. So here urine test is very important. Every time they are asking this. Next, genetics. So genetics subject, it will come in 4th sem, but the exam you will write togetherly, that is pharmacology, pathology, genetics, all 3 subjects you will write togetherly. Now let's see the syllabus. Unit 1, introduction unit, that is practical application of genetics in nursing. So why we are studying genetics in nursing, what is the use, then impact of genetic condition in families, then review of cellular division, mitosis and meiosis. So here this mitosis and meiosis is very important question. Then characteristics and structure of genes, chromosome, sex determination, chromosomal aberrations, patterns of inheritance, Mendelian theory of inheritance, then multiple allots and blood groups, then sex-linked inheritance, mechanism of inheritance, error in transmission. So under all these you may get some MCQs, but mitosis and meiosis you will get for 5 marks. Okay, this is very important. Next, unit 2, that is maternal, prenatal and genetic influences on development of defects and diseases. Under this, conditions affecting the mother. So related to the genetic diseases, what is happening during the pregnancy, what conditions they are getting, so how it will affect the baby, all these things we will see in this unit. So here consanguinity, atopy, then prenatal nutrition and food allergies, maternal age, maternal drug therapy, then prenatal testing and diagnosis, effect of radiation and drugs, chemicals, infertility, spontaneous abortion, neural tube defects and the role of folic acid and lowering the risk of this folic acid we will see here. So then Down syndrome. Here the important questions is Down syndrome is very important. Then here the role of folic acid in pregnancy also, it is very important. Then next unit 3, genetic testing in the neonatal and children, screening for congenital abnormalities. So here we will do the screening for pregnant women to find out the congenital abnormalities. So this is the important question. Then developmental delay, dysmorphism you may get for MCQ, that's all. Then unit 4, genetic conditions of adolescents and adults. So for example cancer genetics, how it will come through the ancestors, for example from the parents to children. Then inborn errors of metabolism, then blood group alleles and hematological disorders, then genetic hemochromatosis, then Huntington disease, mental illness. So these all comes under 4th unit. Next unit 5, services related to genetics, genetic testing, gene therapy, genetic counseling, legal and ethical issues, role of nurse. So here Genetic counseling and genetic testing is very important. They will ask either for 5 marks or sometimes they may ask for 2 marks. So in total question paper, the genetic questions will be very less, but still there are some important questions are there every year they are asking repetitively, like genetic counseling, genetic test, this and all you can study. So we have discussed regarding the syllabus. First we discussed pharmacology, then we discussed pathology and genetics. So many important questions I told you, but still one more time I am going to give you some very important questions which are repetitively coming in your question paper. So for example, in pharmacology, analgesics, then non-steroidal anti-inflammatory drugs, then anesthetics, then anti-anginal drugs, antihypertensives, diuretics, antidiuretics, these are all very important questions. Then when we come to the nervous system, antipsychotics, mood stabilizers, these are all important. Next, pathology. In pathology, system wise conditions are there. In that, in respiratory system we have COPD, lung abscess, these two conditions are very important. Then in the CVS we have congestive heart failure, then angina. So this pathology you need to explain it. Then in the nervous system, tumors, then meningitis, encephalitis, these all are important questions. Then examination of the body fluids, in that CSF, then sputum, urine test, so blood test, this and all very important in pathology. Next, in the genetics, neural tube defects, then mitosis and meiosis, then genetic test, genetic counseling, these all are important questions. So overall you got one idea that which all are very important questions. Next, let's discuss about the question paper. So as I told you here, pharmacology, pathology and genetics, all three subjects are included in one paper. So you are going to write the examination togetherly. So here in section A, pharmacology 1 and 2 included, and in section B, pathology 1 and 2 and genetics is included. So first we are going to see section A. So section A is for 37 marks. So here first they are going to give MCQs. So total you will have 7 MCQs. So here you need to choose the answer in 4 answers and you need to choose the right one. Then next you have essay, that is for 10 marks, and you have only one essay. There is no choice. So previously you were getting the choice, but here now you are not getting the choice. Only one question will be there and you need to answer that. Next you have short notes. So there are 3 questions for 5 marks. So total 15 marks. So you need to answer all the 3 questions. Then next we have give reason, that is for 2 marks we have 3 questions. So total 6 marks. You need to give the reason for the particular given question. So next let's see section B. In section B, pathology 1 and 2 and genetics. So here also same pattern you will get MCQs, essay, then short answers, then give the reason. Next section B. Section B, pharmacology 1 and 2 and genetics. So this is for 37 marks. So here we have total 7 MCQs in one main heading. So here same thing, in 4 answers will be given, in that one right one you need to choose that. Next they have given short notes. Short notes, total 4 questions they have given for 5 marks. So total 4 into 5 is equal to 20 marks. So here you need to answer all the 4 questions. Next main heading is differentiate between. So here differentiate between you have 3 questions for 2 marks. So that is total 6 marks. You need to answer all the 3 questions. Next you have list down. In list down you have 2 questions, that is for 2 marks. So total we have 4 marks under this. So like this 37 marks are divided in the 4 main headings. Here you do not have any choice, you need to write all the answers. Next I will tell you some of the tips to study pharmacology. So pharmacology is all about the drugs, so you will feel very difficult to study this subject. So what you can do is, so system wise when you are going, first you study all the classification and you practice by writing. So what will happen, all the classification thoroughly you will study. After that, under that, for one example drugs you by heart it. So after that what you can do, you can see the important drugs and you can study the mechanism of action and some of the side effects, indications, contraindications, all these things you can study. So you will easily remember during the examination. This trick you can use it. So today we discussed regarding pharmacology, pathology and genetics and how to study for your examination, and some of the tips I have given to you. So you can get good score from these tips. Thank you.